I did make every effort to include the latest scientific studies. Please note though that research is constantly changing and one clinical trial cannot always cover diverse bodies and communities.
Individual responses to foods, herbs, supplements, and treatments may vary based on a variety of factors, including genetics, environment, diet, and other lifestyle factors.
Even solid clinical trials and studies tend to have an agenda or underlying bias, and despite the best intentions and efforts of researchers, the scope and purpose of scientific research will always be somewhat limited by factors such as funding, ethics, and logistical constraints. Relying on a single expert or source can be risky, as errors and biases can occur. It's best to verify information from multiple sources before accepting it at face value. Engage in due diligence and critical thinking to ensure that you are making informed decisions. If you wish to deep dive into the topic, you can check on your references posted in the description box below.
In this presentation, why is alpha-lipoic acid called the universal antioxidant? 12 health benefits of alpha-lipoic acid supported by limited human studies. Potential side effects of alpha-lipoic acid. Doses that are more likely to cause adverse effects. Daily oral dose that appears to provide a favorable risk-to-benefit ratio. What you should know before taking alpha-lipoic acid. And what you can do if you already tried it all and followed many doctors and health gurus but nothing worked. According to a scientific review published in the U.S. National Library of Medicine in 2015, lipoic acid, also known as alpha-lipoic acid, increases the expression of antioxidant enzymes and participates in the recycling of vitamins C and E. Due to these properties, alpha-lipoic acid is called the universal antioxidant. And according to Dr. Montero, one of the authors of the book Defeat Neuropathy Now, there are 3 forms of alpha-lipoic acid and that only R-alpha-lipoic acid is effective and biologically active. R-alpha-lipoic acid, also known as the natural form, is produced by the body and found in certain foods like meat, spinach, broccoli, and tomato. On the other hand, S-alpha-lipoic acid is synthetically made and not in a usable form for the body. It is chemically manufactured and lacks the same effectiveness as the natural form. The body has difficulty absorbing S-alpha-lipoic acid, and it may also inhibit the absorption of the R-alpha-lipoic acid into nerve cells. RS-alpha-lipoic acid is a combination of the natural R-alpha-lipoic acid and the synthetic S-alpha-lipoic acid. Limited scientific studies support the following health benefits of alpha-lipoic acid. 1. May help wounds heal faster. In a 2007 study, researchers investigated the effects of alpha-lipoic acid on the expression of genes involved in wound healing in patients undergoing hyperbaric oxygen (HBO) therapy for chronic wounds. HBO therapy is used as a treatment for wounds that won't heal as a result of diabetes or radiation injury. The study included 20 patients, 7 males and 13 females. These patients had chronic wounds, specifically ischemic diabetic ulcers and ischemic vasculopathic ulcers. The wounds had been present for at least 30 days. The patients were randomly assigned to 2 groups, the alpha-lipoic acid group and the placebo group. The assignment was done in a double-blind manner, which means neither the patients nor the researchers knew who received the alpha-lipoic and who received the placebo. During the study, the patients underwent HBO therapy. In addition to this therapy, the alpha-lipoic acid group received 1 capsule of 300 milligrams of alpha-lipoic acid before each HBO session and another capsule of 300 milligrams immediately after the therapy. They continued taking 2 capsules of alpha-lipoic acid daily for the next 14 consecutive HBO treatments. The placebo group, on the other hand, received a placebo in the same manner as alpha-lipoic acid group. What the researchers found in this study was that when patients received alpha-lipoic acid along with HBO therapy, it helped reduce inflammation and control the activity of certain genes related to wound healing. This, in turn, promoted the healing process and helped the wounds to heal faster. And in a randomized controlled trial published in 2014, researchers found that R-alpha-lipoic acid may be more effective than lipoic acid in improving chronic wound healing for patients receiving HBO therapy. 2. May help manage and prevent diabetes. In a 2015 scientific review, alpha-lipoic acid has shown promising effects in preventing and treating diabetes. It acts as a powerful antioxidant and has insulin-like and anti-inflammatory properties. When consumed, alpha-lipoic acid is easily absorbed and enters cells where it gets converted into dihydrolipoic acid, DHLA, by enzymes. This compound is crucial for the proper functioning of mitochondria, the energy powerhouses of cells. Due to its antioxidant properties, alpha-lipoic acid has gained attention as a potential treatment for diabetic complications such as retinopathy, neuropathy, and vascular diseases. In another scientific review published in 2010, researchers have found that alpha-lipoic acid can have positive effects on insulin function and glucose metabolism in both animals and humans. In animal studies, alpha-lipoic acid has shown to improve the uptake of glucose by muscles, enhance overall glucose tolerance, and combat insulin resistance. Similar improvements were observed in human patients with type 2 diabetes who received alpha-lipoic acid either through injections or by taking it orally. Moreover, in a 4-week placebo-controlled pilot trial in 74 patients with type 2 diabetes published in 1999, more participants who received alpha-lipoic acid experienced an improvement in their body's ability to use and dispose of glucose when compared to those who received a placebo. Specifically, their insulin sensitivity improved by 27% more than the placebo group. This suggests that alpha-lipoic acid has a positive impact on insulin sensitivity in patients with type 2 diabetes, potentially helping them better manage their blood sugar levels. However, more research is required to validate these results and provide a deeper understanding of the effects of alpha-lipoic acid on insulin sensitivity. In an older, smaller clinical trial, it was found that alpha-lipoic acid could improve insulin sensitivity and glucose uptake in patients with type 2 diabetes. Furthermore, in an 8-week randomized controlled trial published in 2011, researchers investigated the effects of alpha-lipoic acid treatment on fasting blood glucose, insulin resistance, and glutathione peroxidase activity in 57 patients with type 2 diabetes. The results showed that, compared to the placebo group, the group who took alpha-lipoic acid had lower levels of blood sugar after fasting and after eating and had better insulin resistance. In another controlled clinical trial published in 2006, 12 patients with type 2 diabetes were treated with 600 milligrams of oral alpha-lipoic acid twice daily for 4 weeks and compared them to 12 others without diabetes. At the end of the treatment period, insulin sensitivity of diabetic patients was significantly increased, and there was no statistically significant difference between the insulin sensitivity of diabetic patients after alpha-lipoic acid therapy and control subjects. This study suggests that alpha-lipoic acid may be useful for managing diabetes. Most European countries have approved alpha-lipoic acid for treating diabetic neuropathy, a condition where high blood sugar damages nerves. Studies show that it can reduce nerve damage symptoms such as stabbing or burning pain, numbness, and prickling sensations. Alpha-lipoic acid may also help with erectile dysfunction in diabetic men. In a randomized controlled trial published in 2013, researchers studied 45 men with erectile dysfunction and type 2 diabetes. Some of the men were given testosterone in a gel form, and others were given alpha-lipoic acid as a supplement. After 12 weeks of treatment, both groups had improvements in their erectile dysfunction symptoms. Alpha-lipoic acid may also improve blood vessel function in people with impaired fasting glucose based on the findings of a randomized controlled trial published in 2011. The study involved 60 participants with impaired fasting glucose and 32 healthy individuals. Half of the impaired fasting glucose group received 600 milligrams of alpha-lipoic acid via intravenous infusion once a day for 3 weeks, while the other half did not receive any treatment. The researchers measured the function of the participants' blood vessels before and after the treatment period. They discovered that at the beginning of the study, the individuals with impaired fasting glucose had impaired blood vessel function compared to the healthy individuals. However, after 3 weeks of receiving alpha-lipoic acid, the group with impaired fasting glucose showed significant improvements in their blood vessel function, whereas the untreated group did not experience any changes. 3. May help with weight management. The inhibitory effects of lipoic acid on the production of chemarin, a molecule linked to obesity and metabolic syndrome, are likely what make lipoic acid effective in combating obesity and diabetes. A team of researchers investigated if taking icosapentaenoic acid and alpha-lipoic acid separately or together could help obese women lose more weight when combined with a reduced-calorie diet. The study lasted for 10 weeks and involved 97 women who were randomly assigned to different treatment groups. After the study, it was found that the group who took alpha-lipoic acid had a greater amount of weight loss compared to the other groups. The icosapentaenoic acid group showed a decrease in a hormone called leptin, which is related to weight loss. Overall, the results suggest that taking alpha-lipoic acid alone or in combination with icosapentaenoic acid may assist in promoting weight loss in obese women who are following a reduced-calorie diet. In a meta-analysis of the effect of alpha-lipoic acid on weight and body mass index published in 2017, researchers searched for 10 articles that met specific criteria for randomized, double-blind, placebo-controlled studies involving alpha-lipoic acid. After analyzing the data from these studies, they concluded that alpha-lipoic acid treatment showed small yet significant short-term weight loss compared with placebo. However, further research is needed to examine the effect of different doses and the long-term benefits of alpha-lipoic acid on weight management. 4. May help slow down the progression of Alzheimer's disease. In a clinical trial published in 2007, 9 Alzheimer's disease patients were given 600 milligrams of alpha-lipoic acid every day for 12 months along with their usual treatment. The results showed that their memory and thinking abilities stayed the same, which means the treatment helped stabilize their cognitive functions. They took tests that measured their memory and cognitive skills, and the scores remained constant throughout the study. Researchers continued the study by including 43 more patients with Alzheimer's disease over a period of up to 48 months. They found that patients with mild dementia had a very slow progression of the disease, with only a small increase in their cognitive scores each year. However, those with moderate dementia had a faster progression, although still slower compared to untreated patients or those on other treatments. The findings suggest that alpha-lipoic acid could be a promising treatment to protect the brain in Alzheimer's disease, but more advanced trials are needed to confirm its effectiveness. In another study published in 2014, 39 Alzheimer's disease patients were divided into 3 groups. One group received a placebo, another received omega-3 fatty acids alone, and the third received a combination of omega-3 fatty acids and alpha-lipoic acid. The participants were followed for 12 months, and their oxidative stress levels and cognitive function were measured. The results showed that the combination of omega-3 fatty acids and alpha-lipoic acid helped slow down cognitive and functional decline in Alzheimer's disease patients. The group receiving this combination had better scores on tests measuring cognitive abilities and daily functioning compared to the placebo group. However, there were no significant differences in oxidative stress levels between the groups. Although these findings are promising, it's important to note that the study had a small number of participants. Therefore, further research is needed to confirm the effectiveness of omega-3 fatty acids and alpha-lipoic acid as a potential treatment for Alzheimer's disease. And in a 2015 animal study, researchers investigated the effects of alpha-lipoic acid on vascular dementia in rats. Vascular dementia is a type of dementia caused by reduced blood flow to the brain. The researchers found that when they blocked the rats' carotid arteries to simulate this condition, it led to cognitive problems and increased oxidative stress in the brain. However, when they treated the rats with alpha-lipoic acid, it improved their cognitive abilities and reduced oxidative stress. 5. May be useful in people with multiple sclerosis. In a study published in 2010, researchers found that alpha-lipoic acid significantly increases cyclic adenosine monophosphate (CAMP) concentration. This increase in CAMP is important because it plays a role in reducing inflammation in the body. Diseases like diabetes, Alzheimer's disease, and multiple sclerosis involve problems with how the body controls inflammation. Since alpha-lipoic acid has been shown to have antioxidant and anti-inflammatory properties, it is being pursued as a therapy for these diseases. And in a double-blind, randomized controlled clinical study published in 2014, 52 relapsing remitting multiple sclerosis patients aged 18 to 50 years were assigned to consume either alpha-lipoic acid, 1,200 milligrams per day, or placebo capsules for 12 weeks. The study found that 1,200 milligrams of alpha-lipoic acid improves total antioxidant capacity in multiple sclerosis patients. This indicates that alpha-lipoic acid could help increase the body's ability to combat oxidative stress. However, alpha-lipoic acid did not have an impact on other markers of oxidative stress, such as superoxide dismutase activity, glutathione peroxidase activity, and melandialdehyde levels. In another randomized controlled trial published in 2005, researchers investigated how well the body absorbs alpha-lipoic acid when taken as a pill, and how it affects certain substances in the blood that are related to multiple sclerosis. 37 multiple sclerosis patients participated in the study. The researchers found that when people took 1,200 milligrams of alpha-lipoic acid, the levels of alpha-lipoic acid in their blood were higher compared to those taking a lower dose, 600 milligrams. However, the levels varied between people. They also discovered that higher levels of alpha-lipoic acid in the blood were linked to lower levels of a substance called MMP9, which is known to cause problems in multiple sclerosis. This suggests that alpha-lipoic acid may help reduce the levels of MMP9 and improve multiple sclerosis symptoms. Another substance they looked at, called SICAM1, showed that higher doses of alpha-lipoic acid led to bigger reductions in its levels. This substance is involved in the movement of certain cells in the body, and by lowering its levels, alpha-lipoic acid may help control the movement of harmful cells in multiple sclerosis.
By the way, before I continue, if you're new here, I'm Jera from the Philippines. Welcome to my channel where I share my knowledge and discoveries about everything related to anti-aging, natural health remedies, dogs and cats, and personal development gained from reading research articles, scientific journals, and books written by doctors and experts. If you also have a gluttonous appetite for new knowledge, please consider subscribing and turning on the notification bell so that you'll get notified whenever I upload new content. Also, you might want to check out my mini ebook, 40 Wrinkle Fighters Other Than Retinol, backed by scientific studies. Just click the link in the description box below for more details.
Moving on, number 6, alpha-lipoic acid may help improve muscle regeneration. Muscle regeneration plays a crucial role in maintaining muscle health and recovering from exercise-induced damage. In a 2013 randomized controlled trial involving 16 physically active males, researchers examined the effects of alpha-lipoic acid on inflammatory response and muscle regeneration. Participants were divided into 2 groups. One received a placebo, while the other group received a daily dose of 1,200 milligrams of alpha-lipoic acid for 10 days before exercise. After a challenging exercise session, blood samples were collected at different time points. The results showed that alpha-lipoic acid increased hydrogen peroxide levels while reducing nitric oxide levels. Additionally, alpha-lipoic acid improved the thiol redox status, which correlated with changes in specific cytokines related to inflammation. These findings suggest that alpha-lipoic acid enhances the regeneration of injured muscles and positively influences inflammatory responses. In another small randomized controlled trial of 12 apparently healthy male participants, researchers divided them into 2 groups. One group received a daily supplement of 1,000 milligrams of alpha-lipoic acid for 14 days, while the other group received no supplement. After performing maximal knee extension exercises, various measurements were taken. The results indicated that exercise increased DNA damage and oxidative stress markers in the group without supplementation. However, the group receiving alpha-lipoic acid showed lower levels of DNA damage and lipid peroxidation. Alpha-lipoic acid supplementation exhibited a selective protective effect on DNA and lipids, suggesting its potential as a defense against exercise-induced oxidative stress. 7. May help support heart health. A scientific review from 2015 highlighted that alpha-lipoic acid possesses direct and indirect effects on blood lipid levels, reducing the risk of atherosclerosis. Additionally, it may help prevent hypertension by lowering inflammatory cytokine levels in the blood, maintaining vessel cell health, and normalizing blood pressure changes. Clinical trials showed that alpha-lipoic acid inhibits excessive production of endothelin-1, a vasoconstrictor, while promoting increased synthesis of nitric oxide, a vasodilator. Moreover, alpha-lipoic acid has been shown to reduce cardiac cell death, or apoptosis, by minimizing oxidative damage to the mitochondria. It increases the levels of an important antioxidant called glutathione and enhances the activity of an enzyme called superoxide dismutase, which helps counteract the harmful effects of reactive oxygen species. Alpha-lipoic acid has also been found to boost cellular defense mechanisms, making the heart more resistant to injury caused by reactive oxygen species. And in a clinical trial published in 2005, 58 subjects with metabolic syndrome were divided into 4 groups. One group received irbesartan, another group received alpha-lipoic acid, a third group received both irbesartan and alpha-lipoic acid, and the fourth group received a placebo. After 4 weeks of treatment, the groups receiving irbesartan, alpha-lipoic acid, or both showed significant improvements in endothelial function compared to the placebo group. The participants treated with irbesartan and/or alpha-lipoic acid also experienced reduced levels of inflammatory markers in their blood. Researchers concluded that administration of irbesartan and/or alpha-lipoic acid to patients with metabolic syndrome improves endothelial function and reduces pro-inflammatory markers, factors that are implicated in the pathogenesis of atherosclerosis. 8. May help support eye health. In a clinical trial published in 1995, 45 patients with early stages of open-angle glaucoma were divided into 2 groups. One group received a daily dose of 0.075 grams of alpha-lipoic acid for 2 months, and the other group received a daily dose of 0.15 grams for 1 month. There was also a control group of 31 patients who only received local hypotensive therapy. The researchers found that the patients who received alpha-lipoic acid showed improvements in their vision, eye function, and the effectiveness of liquid drainage from the eyes. The higher dose of 0.15 grams per day appeared to have a stronger effect. Color campimetry results also indicated improved sensitivity of the visual system in response to the treatment. The researchers believe that alpha-lipoic acid's antioxidant properties and its direct influence on eye tissue metabolism contribute to its beneficial effects in treating glaucoma. And in a randomized controlled trial published in 2016, a total of 100 patients with dry age-related macular degeneration, aged 60 to 83, were randomly assigned to either receive alpha-lipoic acid treatment or a placebo. Various measurements were taken before and after the intervention, including serum superoxide dismutase activity, an important antioxidant marker, best corrected visual acuity, contrast sensitivity, and a quality of life assessment. The researchers also explored the relationship between contrast sensitivity and quality of life scores. The results showed that the alpha-lipoic acid treatment led to a significant increase in serum superoxide dismutase activity, indicating improved antioxidant defense, significant improvement in quality of life scores, suggesting better vision-related quality of life for the patients, and significant improvement in contrast sensitivity, especially at middle and low spatial frequencies. These findings suggest that alpha-lipoic acid shows promise as a potential treatment option for age-related macular degeneration, as it may help protect against oxidative stress and support better visual outcomes. Moreover, studies on rats show that alpha-lipoic acid prevents buthionine sulfoxamine-induced cataract formation and reduces cone cell death. These findings suggest that alpha-lipoic acid may have a protective effect against cataract formation and cone cell loss, potentially contributing to the preservation of vision. 9. May have potential benefits in preventing migraines. In a study published in 2007, researchers investigated the potential of thioctic acid, another term for alpha-lipoic acid, in preventing migraines. They conducted a randomized controlled trial with 54 migraineurs from 5 Belgian centers. After a 1-month run-in period, 44 patients received either thioctic acid, 600 milligrams per day, or a placebo for 3 months. The results, analyzed on an intention-to-treat basis, showed a tendency towards a reduction in monthly migraine attacks in the thioctic acid group compared to placebo. The proportion of patients who experienced a 50% reduction in migraine attacks, 50% responders, did not significantly differ between the thioctic acid group, 30.8%, and the placebo group, 27.8%. However, within the thioctic acid group, significant reductions were observed in attack frequency, headache days, and headache severity after 3 months of treatment. These improvements were not seen in the placebo group. No adverse effects were reported during the study. While this study was interrupted before reaching the planned number of participants, it suggests that thioctic acid may have potential benefits in preventing migraines. However, further research with a larger sample size is needed to draw more definitive conclusions. 10. May help with pain management. Although alpha-lipoic acid is not as effective as conventional painkillers, it has the potential to decrease the amount of medication needed for pain control. However, further extensive research is necessary to fully understand its role in pain management. In a 2015 study, researchers evaluated the effects of a liquid formulation of R-alpha-lipoic acid on neuropathic pain. The study involved neuropathic patients who took the dietary supplement orally. The results showed that the patients experienced an improvement in their quality of life, and there was a significant reduction in various pain parameters such as intensity, burning, unpleasantness, and superficial pain. While further in-depth studies are needed, this initial investigation confirms the potential of R-alpha-lipoic acid as an antioxidant for treating peripheral neuropathy. And in a randomized controlled trial published in 2017, 64 carpal tunnel syndrome patients were randomly assigned to receive either alpha-lipoic acid or a placebo after surgery. The primary focus was on nerve conduction velocity and other factors such as sensory discrimination and pain. The results showed that alpha-lipoic acid did not have a significant impact on nerve conduction velocity or overall carpal tunnel scores. However, the group receiving alpha-lipoic acid experienced a notable decrease in the occurrence of pillar pain after surgery. In conclusion, the administration of alpha-lipoic acid for 40 days following median nerve decompression surgery may lead to a reduced incidence of pillar pain. In another randomized controlled trial published in 2008, researchers compared the effectiveness of acetyl L-carnitine and thioctic acid in patients with sciatic pain caused by a herniated disc. A total of 64 patients participated in the study, and they were randomly assigned to receive either acetyl L-carnitine or thioctic acid for 60 days. The results showed that both treatments led to significant improvements in neuropathy as measured by electromyography at day 60. Thioctic acid showed greater improvements in symptoms compared to acetyl L-carnitine, including better scores on the neuropathy impairment score, neuropathy symptoms and change, and total symptom score questionnaires. More patients receiving thioctic acid reported a decreased need for analgesia compared to those receiving acetyl L-carnitine. In conclusion, thioctic acid or alpha-lipoic acid at a dose of 600 milligrams per day appears to be as effective as acetyl L-carnitine in treating sciatic pain caused by a herniated disc. Thioctic acid may lead to better symptom scores and a reduced need for analgesic medication. However, due to the limited number of patients in this study and the absence of a placebo control group, further research is needed to confirm these findings more conclusively. 11. May help with sperm quality. In a randomized, triple-blind, placebo-controlled clinical trial published in 2015, researchers evaluated the effects of alpha-lipoic acid supplementation on sperm quality and oxidative stress biomarkers in infertile men. The participants were randomly assigned to receive either 600 milligrams of alpha-lipoic acid or a placebo for 12 weeks. At the end of the study, the group receiving alpha-lipoic acid showed significant improvements in total sperm count, sperm concentration, and sperm motility compared to the control group. Additionally, the alpha-lipoic acid group also had significantly increased levels of total sperm count, sperm concentration, and sperm motility compared to their own baseline values. However, there were no significant differences between groups in ejaculate volume, normal sperm morphology, and live sperm. Lastly, 12. May support bone health. Alpha-lipoic acid has been found to prevent bone loss caused by inflammation, according to multiple laboratory studies. In a 2016 controlled experiment conducted on 56 female Wistar rats, it showed that the protective effect of alpha-lipoic acid on bones was dependent on the dosage. Rats treated with 50 and 100 milligrams per kilogram of alpha-lipoic acid exhibited a significant improvement in bone health. In particular, the dose of 50 milligrams per kilogram not only halted bone resorption, but also stimulated bone formation. And in a randomized controlled trial published in 2012, researchers investigated the effects of oral supplementation with antioxidant agents containing alpha-lipoic acid on the bone mineral density of postmenopausal women with osteopenia. 50 women were enrolled and randomly divided into two groups, one receiving alpha-lipoic acid and other antioxidants along with calcium and vitamin D3, and the other receiving only calcium and vitamin D3. The bone mineral density was measured at the beginning of the study and after 12 months using quantitative ultrasonometry. Results showed that the group that received alpha-lipoic acid and antioxidant agents had a slightly better estimated bone mineral density compared to the control group. Although the difference was statistically significant, it suggests that oral supplementation with antioxidant agents containing alpha-lipoic acid may help mitigate bone loss in postmenopausal women with osteopenia. However, it's important to note that the study was conducted with a small number of participants, so further research with a larger population is needed to confirm these findings. Also, the study compared the effects of alpha-lipoic acid and antioxidant supplementation to a group receiving only calcium and vitamin D3. Without a placebo group, it's challenging to determine if the observed improvements are solely due to the supplementation. In addition, there could be other variables at play that may have influenced the results, making it difficult to determine the exact contribution of the supplements to the changes in bone health. The study did not take into consideration or control for other factors that could potentially affect bone mineral density in the participants. These factors include their dietary habits, level of physical activity or exercise, and hormonal status. A popular leading provider of independent test results reviewed some brands of alpha-lipoic acid. I'm afraid I can't share which brands passed and failed their testing. Being a member, the contents of the site are only for my personal, non-commercial use, and I agree not to interrupt or attempt to interrupt the operation of the site in any way. If you have any questions about this, you can send me a message through my contact form in the description box below. Alpha-lipoic acid may sometimes cause mild adverse events such as hives and itching, but the good news is that these effects are usually not serious and often go away without any specific treatment. Some people might also experience dose-dependent side effects such as nausea, vomiting, and vertigo. Higher doses like 1,200 milligrams and 1,800 milligrams are more likely to cause these adverse effects. A daily oral dose of 600 milligrams appears to provide a favorable risk-to-benefit ratio. In the elderly population, a dose of 600 milligrams was well tolerated, while higher doses led to flushing and upper gastrointestinal side effects. However, individuals taking gastrointestinal prophylaxis medications did not experience these upper gastrointestinal side effects. Additionally, one study in mice suggests that excessive intake of alpha-lipoic acid could lead to fatty liver and liver injury. In 2011, a case study reported a rare and severe liver condition in a 63-year-old man with type 2 diabetes, hypertension, hypothyroidism, and stage 2 chronic renal failure who took thioctic acid. This is the first reported case of liver toxicity associated with thioctic acid. However, the case summary provides limited information about the patient's medical history and concurrent medications. It is unclear if there were any other factors or underlying conditions that could have contributed to the liver toxicity. That being said, monitoring cholesterol and liver enzymes during long-term alpha-lipoic acid supplementation may be prudent. Before taking any supplements, it is important to consult with a healthcare professional or your doctor. If you have a known kidney or liver condition, your healthcare provider may suggest regular monitoring of kidney and liver function through blood tests. If your trusted doctor recommends trying alpha-lipoic acid, you can find high-quality alpha-lipoic acid supplements on iherb.com. Save up to 10% by entering APT0317 at checkout. This discount code doesn't expire, so you can cash in on it whenever you shop on iherb.com. Just remember, what works for some people may not necessarily work for everyone. If you already tried it all and followed many doctors and health gurus, but nothing worked, you may find the answer by doing some digging into your genes. If you want to get to the root cause of some of your health issues, the first step is to find your problem genes. Taking personalized supplements based on your DNA may also help, and Self-Decode can help you with that. Self-Decode provides personalized health recommendations based on a combination of your DNA, labs, and environmental factors. There are just too many diets, supplements, and health hacks out there to waste your time and money on stuff that probably isn't going to work for you. So if you want to experiment in the most efficient and effective way, click on the link in the description box below to check out Self-Decode and unlock your own genetic blueprint.
If you've learned something you didn't know before watching this presentation and you appreciate the time I invested in researching, writing, and creating this presentation, please give this video a like. If you're interested in looking and feeling your best and exploring natural solutions, please consider subscribing. Thanks for watching!